And the family of the late Adepeju Ugboma has engaged the legal services of Olisa, Agbakoba and Primera Africa Legal to help with all legal issues and representation concerning her controversial death on April the 25th. Her husband, Ijoma, stresses that she had no pre-existing medical conditions to have developed post-surgery complications that led to her death, but maintained that she died in unclear and suspicious circumstances at Evercare Hospital. They are convinced that this case is one of gross medical negligence. And joining me from the press conference to discuss this is TVC News Judiciary correspondent, Kemi Fola Adeyemo. Kemi, this is a very sad development. The family, of course, we can imagine what they're going through at this time. Bring us up to speed with what's happening at the press conference.
Well, Peju, the press conference just ended. Rather somber atmosphere, understandably, and in view of the big loss the Ugboma family is still suffering from. But they made it very clear that this inquiry and justice they seek on the death of their beloved wife and sister and daughter is not just for her, but for several other women who have been victims of what they call gross medical negligence and malpractice. And so that is why they are going all out, leaving no stones unturned to get justice. Okay, so like you rightly said, the offices of Olisa, Agbakoba, and who is a senior advocate of Nigeria, and another senior advocate of Nigeria, Dr. Boma Alabi, have been given the right to represent them legally, and they have gone all out now, sending out several petitions to various public and private bodies. They have also gone as far as requesting that, or carrying out an independent autopsy. We await the result of that independent autopsy. It's instructive to note at this point that at the time when the late Peju passed on, the initial hospital where she had that operation offered to have an autopsy carried on her because she died in the referral hospital, but the family turned that request down outrightly, saying they would rather opt for an independent autopsy, and that result is what we are waiting at the moment. They've also requested and obtained medical reports from various hospitals. They say she was using about 5 hospitals before she died. 4 of them have even willingly given the family the medical report, but they insist that only Primera, the initial hospital that did the operation, had refused to send its report, and now they're asking questions. They've also sent a petition to the Medical and Dental Veterinary Council of Nigeria, as well as the Nigerian Medical Association. They also want a coroner's inquest to be carried out on the said hospital, quoting the referral hospital that it received Peju after the complications arose. They quoted the doctor who managed Peju, or who saw Peju at the time she was referred in, that the doctor said this is a clear case of a coroner's inquest. So, all these pertinent questions are being asked. Let me just add at this point that they have also triggered steps at the Lagos State House of Assembly for a public discussion on the whole issue of critical medical reforms to be carried out in Nigeria. And they urge that when this is done, it be named after the deceased in her name, the Peju Ugboma Health Reform Initiative. So steps have been taken. The government is hoping that action will be expedited and all the critical answers will be given.
Thanks, Kemi. That medical report from Premier Hospital for the autopsy has been a bone of contention. We'll see how that plays out. Thank you so much, Kemi, for that comprehensive update.